Hi, Strong Mom Society. So today we are going to work on some more of those corrective exercises. And now that we've worked on the diaphragmatic breathing, the pelvic floor, we're going to put that whole core breathing belly pump together with lower body movements. So because we're focusing on corrective exercise, we are going to continue to cue that full activation on every single repetition. Once this is ingrained in your body, we're gonna move past that. You won't have to do this work at this much of a deep thinking level. But for now, I want you to move slowly. I want you to take this at your own pace, and let's continue to work on strengthening that brain to muscle connection. So for this workout, you are gonna grab yourself some water, have it close by, and then this is optional. I've got myself a stretchy band. This could be a TheraBand, it could be a loop, it could be free weights. I'm all about using whatever you have available and just using what's around you. So you're also welcome to do this with nothing at all. I'm gonna give you options for both. Let's dive in. So I want you to start by turning on that core breathing belly pump, and then we're gonna add in some pelvic floor activation and some scapular activation. So we're always working on this pump with these postural muscles to begin our workout. I want you to bring your hands to your lower belly. Go ahead and close your eyes. Just sit in any comfortable position. It doesn't have to be like this. It could be on a chair even, cross-legged, whatever works for you. I want you to elongate your spine. So feel the tailbone dropping down towards the floor. And then I want you to just imagine that there is space between each of your vertebrae all the way up to the top of your head. Take in a nice deep diaphragmatic breath. So you're gonna breathe into the sides and backs of your ribs. You might feel a little bit of extension in your belly as you take that inhale. And then as you exhale, I want you to stop the flow of urine, stop yourself from passing gas, and then start to zip up that entire core. So you can think of this as a corset, you can think of it as a zipper. If you're pregnant, hug that baby towards you. If you're postpartum, just think of cinching that waist from the bottom to the top, not from the top down. So you wanna make sure that that pelvic floor is active first. Take that again. Inhale, take a nice full diaphragmatic breath. Exhale, close and lift the pelvic floor. Feel that wrap happen from the bottom, middle, and upper layer. One more time. Inhale, fill. Full relaxation. You feel the release at the bottom of the pelvic floor. Exhale, close, lift. Those two actions of movement in the pelvic floor. Wrap and zip those core muscles up the front of the body. Great. So what I want you to do now is use this belly pump a little faster, that pelvic floor lift, and force that air out. See how quickly you can turn on this movement. Inhale, release. Exhale, starting from the pelvic floor. This is called a piston. If you need more information on the pistons, go to the bottom description of this workout. I will link that video for you so you can go a little deeper into it. But for now, just practice lifting really fast, and then inhale, take a full release. Exhale, inhale, pelvic floor, let's go. Exhale, inhale, let go. Add this piston with your scap activation. Scaps are those shoulder blades on your back. I don't want you to squeeze them together high. I want you to think of the lower inside corners of your shoulder blades dropping down, kind of fanning down and slightly together with that piston. So those postural muscles are on. Inhale, relax the pelvic floor. Release the belly, breathe into the diaphragm. Exhale. Pelvic floor is lifted, belly is wrapped, scaps are on. Inhale, exhale, inhale, exhale, inhale, release, exhale, pelvic floor, scaps are down, active, coming together at the bottom of the shoulder blades. One more time. Inhale, exhale. Great. Roll over onto your back. And you're fine here if you're pregnant, as long as you're not lightheaded, nauseous, dizzy, anything like that. We're actually gonna lift the hips, which takes all pressure off of that vena cava. So parallel those feet underneath you. I want you to lift up into a glute bridge. And then we're gonna take what I call 80-20. Put 80% of your weight into your right foot, 20% into the left. And we're gonna take glute bridges from here. We're gonna inhale, exhale. So I want you to find the breath pattern that works for you. Does it make sense for you to inhale on the way up or inhale on the way down? And I want you to just keep a nice active pelvic floor. Think of that belly pump every time you breathe out, wherever that exhale is. When you inhale, I want you to connect to feeling the belly expand, pelvic floor relax. So maybe that breath is long through a few repetitions. Maybe it happens on every single repetition. But the important thing is that your brain is recognizing that this breath, this core activation, is a part of the movement, that these two things are not separate in our bodies. We're just trying to lay that really strong brain to muscle foundation. Whoo! And then we are gonna come down, switch over, take 80-20 on the other side. 80% of your weight into your right foot, 20% into the left. And then connect that belly pump with this movement. So just put that up and down on autopilot. Ideally, we feel this in the glutes. If it's not there yet, it's okay, because we're still working on that brain to breath connection. We will get it to your glutes eventually, I promise. We're just gonna keep squeeze, release. Feeling that left glute, or just the presence of that left leg doing the work here. The right leg takes a little bit of a break at 20%. Full diaphragmatic breath in, relax the pelvic floor. Exhale, close and lift the pelvic floor. Feel that belly pump. Give me 2 more. And last one, good. Just from that exercise, you can start to make a self-assessment on which glute is stronger, which one got tired faster, which one was harder. That's probably your weaker side. And if you want to start to work out that imbalance, what you can do is take a little rest here, and then go back into the side that felt harder. Give yourself 10 more repetitions. So if you've noticed that you've got a side, go ahead and push pause on this video right now. Do 10 more reps, 80-20 on that weaker side, and then come back to me. Okay, I want you to roll over to your side. And what you're gonna do is station your elbow right underneath your shoulder girdle. Few options here for this lift. You can either have this hand down, this is the most supportive. The next option is to bring your hand up to your hip. The third is gonna be here. So I want you to use that core breathing belly pump, close and lift the pelvic floor, wrap the core. Make sure the ribs aren't splayed open here, that you've got a good connection of your ribs on top of your hips. And then use that activation to help you lift. This lift is where you need the most strength. So I do want you to think about hugging those core muscles towards you as you come up into this activation. The other thing I want you to think about is the scapular activation. So this right shoulder is not creeping up to my ear. It's actually really stable, and that scap is anchored down my back. We're gonna inhale down, exhale, close in with the pelvic floor, wrap the belly, find that scap activation. Inhale, exhale. We're just gonna take 2 more here. This workout's actually about the lower body, but I do like to turn those obliques on just so the full system is working together as we do more complex movements once we stand up. We're gonna wrap that core and then flip ourselves over to the other side. So same thing here. Find that alignment of your elbow right underneath your shoulder girdle. Anchor that scap down, close the ribs on top of the hips. You've got a strong line from head to tail here. Either here, here, or you can extend that arm up to the ceiling. Inhale, full release. Exhale, close and lift the pelvic floor. Hug that belly towards you. Feel that oblique activation here. If you don't feel it, just think about it. Think about how that oblique is doing the side lift. Inhale, down, reset. Exhale, close and lift, starting with the pelvic floor. Lower belly hugs in, everything lifts up. So you're gonna take these at your own pace. Because we're working on that connection to your breath and the movement, this isn't about getting the repetitions in. It's really about doing the repetitions with the correct activation, with the correct breath and movement pattern. So if you're doing 1 for my every 5, it's okay. Your body is gonna speed this up as this becomes more ingrained. Again, think about that scap activation. If that ear is creeping up towards your, that shoulder is creeping up towards your ear. I'm gonna give this 1 more. And come down. Good. I want you to come onto your back. And we're just gonna be here for a second for some supine tucks. Supine means on your back. So knees up to the ceiling. If you don't feel good here, you can do these on your side, so feel free to just roll over to your side. But I want you to exhale, curl your pubic bone up towards your nose, press the small of your back into the floor. As you lift and engage the pelvic floor and you feel those lower abs wrap. Feel a little bit of heaviness here in the front of the ribs so they're not popped open. You should feel some core activation here and a little bit of pelvic floor as well. Inhale. I want you to just release that. Don't go into a big lower back arch here. You're just releasing back into neutral. Exhale, close and lift the pelvic floor. So I'm stopping the flow of urine, stopping gas. I'm feeling that really deep activation from hip bone to hip bone. Zipping up from there, dropping the ribs. That's my exhale, and then inhale. Now on that inhale and you go into neutral, try not to let the ribs pop open. Try to keep them softened and pressing down so the back of the rib cage is really heavy here. Exhale, stop the flow of urine, stop gas. Feel that zip or activation, that corset, everything up the front of the belly. Inhale, release into neutral. Exhale one more time, pelvic floor, lower abs, scoop out the front of the body here, tons of core activation. And inhale, let it go. I want you to roll over to all fours. Just take a little bit of wag the tail here, right to left. And then imagining that there's a pencil on the end of your tailbone, I want you to just take some circles. When you're in this all fours position, find some scap activation. If we don't have that connection between your scaps and your wrists yet, go ahead and pop up if there's any pain in your wrists. Take that pencil, draw a circle in the opposite direction. And then we are gonna come up to a kneeling position. Draw one leg in front. If you need a little extra padding underneath this knee, put a pillow, a blanket, roll that mat up a few times. And I want you to just shift in and out of that front leg. As you do this, I want you to physically tap or hit that glute on that left, sorry, I'm on my left leg, I think I said right. But as you shift in and out of this left leg, I'm tapping the left glute because I want my body to recognize the connection from this heel, putting pressure down into this foot, up the back of my leg into this left glute. When we get up and down out of the floor, we don't want to just muscle up from our quads. We're going to work on glute loading as we get up and down out of that position. The thing that's going to help with that is that core breathing belly pump. So inhale, fill. Exhale, shift, wrap, engage the core. Inhale, fill. Exhale, lift the pelvic floor, wrap, shift like you're gonna stand up. Take that one more time, we're gonna stand up on the fourth. Exhale, pelvic floor, shift. Tuck those right toes under. Inhale, release. Exhale, pelvic floor, lower abs, shift. Find that glute on your exhale to stand. Same thing to go back down into the ground. We don't want to come here and just descend into a heavy quad load. There's a lot of pressure on this knee. I want you to find your glute. It means you're going to stick your butt out to the back wall. Wrap the core, lower yourself down. Inhale, release. Exhale, pelvic floor, lower abs, shift. Find that glute, tap it if you need to. Inhale. Exhale, pelvic floor, abs, scaps are engaged. I'm shifting to find that glute to bring myself down. We're gonna switch over to the other side. So first thing you're gonna do is find that shift forward as you tap in and out of this right glute. So your brain right now is making the connection between a movement forward, weight down into this heel, up the back of the leg, into this glute muscle here. Inhale, exhale, pelvic floor, wrap the core, scaps engaged. Practice that shift. Full release on that inhale. Exhale, shift. One more time to practice, up on the fourth. Inhale, release. Exhale, close and lift the pelvic floor, wrap the core, shift. Up on this one, you're gonna tuck those left toes. Inhale, release. Exhale, pelvic floor, wrap the core, find the scaps, shift, bring yourself up out of the ground. Inhale, let it go. breathe into that diaphragm, relax the pelvic floor. Exhale, lift, zip, wrap, shift it back. Find that glute drive into that heel to lower. Inhale, release. Exhale, shift, wrap, lift, glute to rise. Inhale to reset. Exhale, pelvic floor, wrap, shift it back. Really take that sits bone behind you to lower. One more time up, we're gonna stay up on this one. Exhale, shift. As you go into that core breathing belly pump, bring yourself up to standing and meet me up here. Whew. Grab yourself a sip of water if you need it. I'm gonna take a quick one. And we are gonna, ooh, nice. We are gonna head into a static lunge. So this one can be tricky for a lot of people with knee issues. If you do tend to have knee issues, you're really gripping in the quads, you've got really tight hip flexors, I want you to grab yourself a chair or hang onto a wall for this one. I do, in addition to getting this core breathing belly pump on with this movement, want you to start to feel this in your glute, not your knees. So we're gonna take the left foot forward first. And just take that other leg back a few inches. Either you're doing this freestanding without a balance or hanging on to something. I want you to shift your hips behind you. So we are in this hinge. Now, be careful, because if we have postural changes that have caused us to go into a chronic tuck or a big overarch, you might find yourself wanting to do one of those two positions in the shift. I want you to think of your sits bones here and here, bottom of the butt. You're just hinging forward. As you hinge forward, those sits bones are gonna wide, they're going directly behind you. Now I want you to drive in and out of that front heel with just a tiny little pulse here. Connect to your core breathing belly pump as you do it. I'm finding a ton of activation in this left glute. Outside of this left hip is also stabilizing. I don't want you to feel this gripping in your quads or pressure at the front of the knee. If that's the case, try to shift your butt back even more. Maybe lower your chest a little bit. Play with this upper body angle to see if you can get out of your quad, out of your knee, and into your glute. Now, you probably wouldn't go into a class, and if they're doing static lunges here, you probably wouldn't go into this pretty extreme position. Don't worry about it. I want you to do what works for you. I want you to find that glute for now. We'll correct things to look a little more normal later on down the road. But for now, the important thing is finding that glute activation as you hinge and bend forward on one leg. We're gonna take it over to the other side. Take that left leg behind you. Find that connection from the heel up the back of the leg into that right glute. Shift your hips behind you. Hold the balance if you need to. And in addition to coming up and down out of that knee bend, we're looking for the glute. We're also trying to incorporate that core breathing belly pump somewhere, either on the way up or the way down. Doesn't matter at this point, just breathe. Just remember to connect your movement to your breath. We're gonna take about 2 more on this side. And again, this is just like those 80-20 glute bridges. If you have trouble on one side, or maybe one glute feels more exhausted than the other, one leg feels a little trickier, push pause right now, go back and do 5 more reps on that trickier side. Okay, one more. We are gonna finally use this band. If you've got a band, great. This could be a towel to pull on. This could be some free weights to hold in your hands. But what I'm gonna do, and I'll give you a few options depending on the props that you have. I'm just gonna stand here on this about hip width apart, and I'm gonna bend down like I'm reaching for something, and I'm gonna pull back up. This gives me just the tiniest bit of resistance. Free weights are just gonna hang in your hands as you do it. If you've got a towel that you're pulling on, you can come down and just pull as you stand. I want you to engage your scaps on that way up. So find the scapular activation at the top. So we are gonna go into this deadlift, bending down. This is that same hip hinge. You're trying to get your hips, your sits bones behind you. So we're not tucking under. We're also not in a big arching lower back. It's just neutral pelvis, sits bones go back. Little bit of pull or stretch at the hamstrings, back of the legs here. This is my breath in. And then I'm gonna engage my pelvic floor, wrap the core, pull those scaps down to stand. I've got full core activation, postural muscles on here. Inhale, release, reaching down to pick up something heavy. Exhale, lift the pelvic floor, wrap the core, pull those scap muscles down and together and stand. Inhale, exhale. Good, if you've got those free weights, it's just gonna be a hang here with the weights up. If you've got a towel or something, a band that you're pulling on, exhale here. Good, take 2 more. Exhale, pull. Last one, inhale down. Exhale, pull. Great job. I want you to grab yourself a sip of water. Take a few lower body leg stretches if you need to. Maybe circle out the hips, head into a leg stretch video. Repeat this as often as you need to. Again, it's not about getting those repetitions in, feeling the burn. This is about quickening or strengthening that connection from your brain to the muscles as we start to put all this work together. Great job today.